The US spends more on healthcare than any other country. Our life expectancy outcomes are not at the top, 3.5 years on average less than the OECD countries.
What does healthcare look like in the US prior to World War II?
Medical care became more valuable, more expensive, and more variable.
The AMA in particular have hired this firm, Whitaker Baxter's.
They took Hollywood tactics and they used that in policy. They won over 90% of all the contests that they were in. There are many ways to achieve universal health care, and it's a fundamentally challenging problem.
What does healthcare look like in the US prior to World War II?
Not that different from a lot of other places in the world. So at the time, there was really only one developed nation that had comprehensive social insurance. It was the founder, which was Germany. The UK had it did have an insurance product, but it was very limited in scope. And in fact, much of the world just didn't have any product that would defray the financial costs of medical care because medical care in itself was not all that valuable. So it was only over the course of the First and Second World War, and nothing's as good as for technological growth as war. So there was a lot of investments in things like antibiotics, anesthetics, surgical techniques, radiography, that all really came out in that sort of early 19 teens to 1920s type situation, and then even more in the 1940s with the Second World War. And that really made it such that medical care became more valuable, more expensive, and more variable, which is when, of course, people need a product to potentially help provide security for them should they face an illness that could have devastating financial consequences for their families. And so, so the US was similar in that regard.
Yeah, I know, particularly in like the UK, although we don't have obviously the NHS in particular kind of comes out in particular like the 2 years sort of post-war and kind of Attlee's government, and the work, it being such a large historical event on the continent, it really reshaped people's idea about what they wanted from their government in terms of healthcare and services and things like that. And so, does World War II change American citizens' attitudes towards healthcare at all? Like before this time, do they have more of a individualistic idea of what healthcare should be provided, whereas potentially after this, attitudes change at all? Or?
Well, the entire project started as sort of an exercise in cultural economics. And I don't want to try and dispute or counter the narrative that Americans are individualistic. I mean, as an economist, we always think about selection versus treatment effects. The people that select to move to the United States typically are people that are branching out. Sometimes they're anti status, they're fleeing state persecution, or they want to, you know, leave their country behind sometimes and start anew and have that sort of entrepreneurial spirit. So that is, I think, at least part of the narrative of America. But that's kind of a constant theme. I mean, it's a theme that we can tap into, and I'm sure the UK has another kind of theme that can be tapped into about what it means to be British, for example. But but that I mean that if I mean I think what was striking about World War II and actually just the technological growth that was a characteristic of the First World War and then the Second World War, um, was that people were starting to demand a product to offset these costs. And countries all over the world were struggling with this problem. And I think the UK really provided, because even though the legislation didn't get passed, I believe until 1946 and then instituted in 1948, there was a lot of discussion prior to that. And so I think it started to really come top of mind. And actually, it had been top of mind ever since, when you think about what do states do, and you all in the UK know this very, very well. Like, what is the state supposed to do as part of its functions? One is provide defense and national security, but another is this idea post industrialization with families not being as important in care is to provide social insurance. And so in the US, we had the Social Security Act that came out of the Great Depression, but and we already had unemployment insurance and disability insurance, but the one thing that we kind of lacked was the medical insurance. And so as the demand and agitation for that was growing, because the expenses were increasing, other countries were talking about it and doing it differently. Then we have this sort of, are we going to go the British way, or are we going to, you know, do something else?
Hmm. No, certainly. And I think from just having a read of your paper, the AMA, as I believe, seems to have a lot of big influence in what ended up happening in terms of the actual policy that was implemented across America in terms of its healthcare policy. Could you just maybe elaborate a little bit on that, some of the influences and how the modern American medical healthcare system was born?
Yes, absolutely. Well, for people that want the fast version, the AMA won and the BMA lost. So the American Medical Association won, and the British Medical Association and pretty much all other organized medicine actually negotiated with their governments and came to different understandings about how they were going to shape their healthcare systems. So most other countries, organized medicine, actually negotiate today with their government over, you know, the P's and the Q's. What are they going to get paid and what's covered in the packages? The AMA did not want to negotiate with the government. They were in a pretty strong position post World War II. The technological growth had meant that there was big range now. The medical corpus had expanded a big range of tasks that grew into specialists. And these specialists started earning a lot of money and they started dominating the AMA. Now, they were never brought to the negotiating table because of what I cover in my paper, which is because they took a totally different route of raising a lot of capital, pouring it into a massive public relations campaign that was orchestrated by this phenomenal firm, Whitaker and Baxter, based out of California, telling everyone that anything that has any hint of government is socialism, socialized medicine, and signing people up for the doctor's plan, this alternative plan. So that was the strategy that they took instead of, reluctantly negotiating with the government. They didn't ever have to come to the table. And I think that's a big kind of departure point. What I want to stress is that I think doctors in both instances, and I think doctors today, speaking now as a physician, do care both about their own material well being as well as the concerns about their patients. And I think both of those things were factors amongst all physicians in all parts of the world when they were thinking about, well, what is the state going to do in this space? Are they going to provide necessary financing? And are they going to basically tell us that we can't treat our patients, which is always a concern.
Sure. And could you just actually elaborate a little bit for me on what the AMA and BMA are, just for the people who
Oh,
maybe
yes,
aren't quite as
exactly.
informed?
So they call it's like organized medicine, which is it's not a union, which is interesting. So it's not like it's collective action without being a union. So it's essentially like a civic interest group organization. In the US, we would label it as an interest group. Um, but it's a structure whereby physicians can come together as a professional organization and make their views known on policy. And they also have a really important role to play in the regulation of medicine and who can practice medicine and what the standards should be. So they've always it's always played a really important role in sort of the professional practice of medicine and the regulatory aspect of medicine. And I guess what separates it maybe from what might be more familiar as a collective for workers is that typically, unless they're negotiating with the government, which is what a lot of what these associations do now in some form or the other, um, typically they weren't seen as sort of like unions in the sense that there would be dues that you would pay and then you would, you know, negotiate with your employer for benefits. At least, again, this is the U.S. Context. We wouldn't consider like the AMA a union.
Got you. And so they're providing support. They've got this, the AMA in particular have hired this legal firm, Whitaker and Baxter, to kind of put this
Public
together.
relations. Public
Yeah,
relations.
so
Sorry.
from what I gather, this is like the first major political PR firm potentially in like American history, and they have this really substantiated effect on the campaign in particular. And I think you go into a little bit about how they do this and how they sort of promote kind of this.
Yes. Yes. They are. I think it could be one of the main distinguishing factors, not the only one, because again, they were able to tap into this deeply held sort of anti-statist sort of, we're individualist value of America, but they were the innovator firm. As far as we can tell, and this is not just me, this is historians, they kind of they came out of California and they took what you could describe as like Hollywood tactics and business style marketing, and they used that in policy. Um, and so they just noticed there was an opportunity because California was a direct democracy state. So if you live in California, you get resolutions and propositions and recalls put directly to the voter, and that was a state constitutional change in 1911. And they came in a couple of decades later, noticing that, like, wow, there's a lot of things on the ballot and a lot of things that, they didn't immediately kind of have an anti progressive bent, but they quickly became, those were the people that could pay most handsomely. So they did some work for the teachers union, but, well, a lot of times they were on the side of business, PG&E, which is a gas and electric firm here. So lots of things like that. They won, I think, over 90% of all the contests that they were in, and they said, they had a lot of little quips like the average American doesn't want to be educated or informed; they want to be entertained. Um, they, yeah, they were legendary, and when, as I mentioned, after the Social Security Act that FDR put in place that gave us old age security insurance in the United States, when the FDR did not include medical insurance, that agitation for something to defray the cost just went to the state level. And one of the states that was interested in passing state sponsored medical insurance was actually California. And so they beat Whitaker and Baxter were hired by the State Medical Association of California Medical Association, and they developed a lot of the playbook that they would then take to the national level in the 1948 contest against Truman. They actually kind of did a mini version of that in California earlier in the 40s against the governor, Earl Warren.
Got
And
you.
they beat the first attempt by one vote.
Ooh, close.
He tried like 6 times. Earl Warren was not for the faint of heart. He was like a massive man, like, you know, in every sense of the word.
Yeah,
And
imposing.
yes.
Got you. And so, what does this lead to in terms of the American private healthcare system? What is it specifically that they're kind of campaigning for, and what do they get out of this as a result?
Well, again, and this is right now I'm researching the British system because, and I looked at Canada too. It's really interesting. Each of these experiences are so interesting. They have a lot in common and some that differences too, because every place had this sort of voluntary system. You would call it voluntary system, very robust in British system. Mostly, it was philanthropic and charity. that was running all the hospitals and things like that. Um,
Hmm.
and so they kind of say, well, the voluntary way is the American way. That's the main idea. Private way is the American way. That's actually how I teach it in public economics. If it's not owned, administered, and provided by, you can either do those things by the public, or one minus public is private. Doesn't matter if they're not for profit or for profit. It's just outside of the public sector. And so they called it the voluntary way. And what it meant in sort of practical terms is it meant that the doctors themselves had put together their own insurance products. They didn't call them insurance. They weren't actually technically viewed as insurance. They were called prepayment plans. And they were able to stand them up relatively quickly because they got allowances at the state level, called enabling legislation to basically, they didn't need to have large capital reserves. They could just stand up these products that were kind of thought of more as pay as you go systems. So the doctors would set the prices, get all the doctors to be in the network, set the price, and then they would pay the people.
So it's an interesting situation. Again, I come from the UK where we have kind of obviously the NHS, a public healthcare system. And I think some of the discourse that I've at least seen when I was kind of like researching the episode in regards to private healthcare in America is that ultimately, or private healthcare insurance, is that insurance tends to work quite well when you don't necessarily know something's going to happen. So the reason why car insurance can work quite well is because it's not necessarily guaranteed that someone's going to have an accident, right? Someone's not guaranteed to. But with healthcare, over the course of your lifetime, you are pretty much guaranteed to have to use it at some point.
That's a
And
really
so
yeah, yeah.
it's an interesting system in which you're having to pay for an insurance scheme, but of course the insurance is going to cost a significant amount because you know you're going to have to use it. So it sounds as though in this period, though, they're trying to. I don't know whether it's a case of whether they were like this or whether they're just framing it like this, but they're or framing or creating these like a prepayment system. So it's a system of, I don't know, you're putting money
Yeah,
in and
you
it's
would
kind of
pay a little. Yeah.
agglomerating as you go over time, as opposed to an actual insurance system, maybe.
Yeah, they did not call it insurance. They called it a prepayment plan, and eventually it gets called insurance. Um, but you're absolutely right. I mean, the way that it was originally structured, it was, and this is all evolving. It's evolving as they realize, okay, we're going to offer it to people that are sort of in the middle of the income distribution. The poor are going to be community responsibilities. The rich, maybe we can still do the fee for service thing with the rich. There's not going to be any prevention because that wasn't really, institutional care, venereal disease, TB. These are all outside the scope. Pregnancy, pretty much outside the scope of these products that they're putting forward. And then they eventually develop like waiting periods, exclusions, things like that. But really, I think a major shift occurred because they're still kind of operating at a nonprofit firm, but and so the goal of the campaign of Whitaker and Baxter is both to say when Truman comes around and wants to complete the deal of FDR in 1948 and 49, they want to stop that legislation first and foremost. They get a lot of, their doctors giving patients pamphlets that say it's socialized medicine. They have a massive newspaper campaign with industry helping them out, other industries kind of coordinating with them and calling it socialized medicine. But the other part is getting people signed up in these private plans because you know that the support for a public system is going to erode. You're going to divide the electorate. You're going to get some people that can pay with a private system, and they're not going to then want to see their taxes go to anything that in the public sector. So that's a big part of the Whitaker and Baxter plan. They say that's got to be the long term objective is to pose this. So we have to get people into it a private alternative. That private alternative, even after everything's said and done, Truman is defeated, the AMA is victorious, the legislative calendar moves on, Republicans adopt the AMA stance as part of their platform with private insurance for those who can pay for it, and then some sort of indigent grant for those who can't. Um, Even after all of that is decided, it becomes clear that these voluntary systems cannot provide healthcare or, to cannot finance healthcare for everyone. It's just they can't stay solvent. That's the problem. Like you cannot, without massive government intervention, you cannot keep, you know, you cannot actually provide healthcare, pay for healthcare for the chronically ill, the elderly, the young, the pregnant. You just can't do it. And so then it becomes like, well, those are the people that need it the most. But the first thing they do in 1954 is they say, okay, well, what if we make premiums tax exempt? So what if we just don't so we can maybe expand who can get insurance by just making it tax exempt. Okay, that is a massive distortion in the economy. It means that today the US government loses $300 billion annually on premiums that are not taxed, payments that you made. It also floods the market with commercial insurance because now they see, look, there's this government, you know, more and more people are going to be looking for private insurance now that it's tax exempt. And these private companies have an advantage, like Aetna and others. They have an advantage of they can do experience rating because they're actual insurance firms. So they can do insurance rating, they can offer their product across state lines. And now the blues, which were kind of trying to operate at this level of being sort of like balancing the profit margin with the patient interest, et cetera. Now, in order for them to stay afloat, they kind of have to converge to what the private sector is doing. And still, that doesn't do enough. Still, we can't cover everybody. So in 1965, we have Medicare for the elderly and Medicaid for the indigent, because no matter what you throw at the private sector, they're never going to cover those people. You
Hmm.
have to throw a lot more, which is where we get to Obamacare.
Yeah, right. No, certainly. And I guess that's a place to sort of interject then and basically like this privatized system of healthcare that comes in post World War II. How does it change over time into the system we see today? Obviously, there's going to be a lot of nuances over that time span and different changes. Like say, Obamacare was a sort of big change, obviously in that regard as well. But I guess from just like the high level standpoint, what's the difference between the kind of privatized system of healthcare and in that time versus the system that we see now?
Great question. I mean, at that time, it was basically like if the doctors could have had it their way, they would have just stayed as, I would charge Mac a lot because he has money, and I wouldn't charge Jane because she doesn't. And they would just do, price discrimination that way. But then
Yep.
things become more centralized in hospitals, more expensive, specialists, et cetera. People can't afford it, or they
Which is
become
very common actually in other places in the world. I did an episode on uh, healthcare in Pakistan actually, and for example, that this happens quite a lot because there's a lot of privatized systems out there. For example, the transgender community out there who are kind of extradited a little bit, but they usually actually get cheaper healthcare in some regards if they go to certain medical centers because of sort of these kind of price discriminations that they kind of introduce. But obviously, that's obviously a very different world from the American system.
yeah.
And so, how does it
Yeah.
then evolve from there?
Yeah, so then things become more hospital based and things and more expensive and like, the idea that you would go bankrupt to, get a treatment for pneumonia is starts to arouse public sentiment. And so what the doctors initially do is they build these plans, right, where you can, if enough people in your community or your workplace agree, in addition to, collect giving your when they give your wages, they'll just save a little bit and give it to the doctor's plans. So these doctors' plans are usually there's only a few per state. They kind of consolidated into one per state. That's how it is now in the US. Blue Cross Blue Shield operate at the state level. and you would have hospital services covered through something called Blue Cross, and you would have your doctor's services covered through Blue Shield. And the doctors would in the state would get together. They would decide what the how what the reimbursement rates would be, what the prices would be for everything. They would take all the money that they had in, and then they would give it out back to the doctors according to the number of patients they see. I mean, this is the beginning of claims, receipts, right? They're just receipts. This is what I did. Pay me this amount. And but but that was all sort of doctor owned, initiated, run, and that's what they wanted. They wanted to control. They wanted the autonomy to control both, you know, how much they charged it, but importantly, what they did for the patients. Sadly, very, I think, kind of, I think I have a op-ed running around a Pyrrhic victory because I think doctors today, given the corporatization of the healthcare sector, given after the tax changes, after the subsidies, kind of begging the private sector to come in and sort of help expand this market, quote unquote, physicians have been, actually they've been kind of sidelined. I mean, there's some physicians that are in the C-suite now, right? With the, MD, MBA kind of running the hospital or running the health system or helping, decide which claims are legitimate in the insurance firms. But most physicians are now it's over 75% are employees in America today. And they don't have that, that place at the negotiating table because they never took it. They rejected it. Um, and they could not have foretold the way that the system is today with a few large insurance firms who now negotiate against these larger and larger health systems. And the doctors are just kind of, considered providers in these large systems and employees.
Yeah, no, it's certainly it's very interesting in that regard. And before we get on to some of maybe the nuances in regards to the pros and cons of some of the systems, I'd just like to maybe ask a question in regards to Whitaker and Baxter's campaign and the AMA actually. Do you think that private healthcare in the way that it manifested in America could have happened without their influence? Is it something that you think that perhaps without maybe the success of the campaign could have looked very differently? I'm curious as
Well,
to
Max, you're an economist, so you know we're not allowed to do those things. Well, some people do them, structural estimation with these wonderful counterfactuals, but I'm not one of those types of economists. I will say this. I think if the AMA had been not so vehemently opposed, and I think if and I think they were so incredibly successful. They were what gave like fuel to their fire was Whitaker and Baxter. I mean, they were so good at their jobs of mass persuasion. They had that persuasive technology down. They had the mass communications. They had the trusted messengers, and they used those to greatest advantage. Um, so I think that for sure, if organized medicine had been for it, that would have been a game changer. And I think the fact that they were able to be so successful against it, I do think that is the secret sauce of Whitaker and Baxter. I mean, of political public relations. The executive branch had no idea, had never seen anything like that before, had no idea what they were up against. The only people that ran campaigns like that on a national level was the government. The government would do things to, get you to buy Liberty bonds or plant a victory garden during the war effort, and would control the media in that way. This was unprecedented.
and how has that shaped the landscape of, I guess, the healthcare politics in America all the way up until today? I mean, my understanding would be, although I'm not particularly informed on the matter, is that a lot of these PR firms and strategies are actually very, very commonplace now. If anything, they're a little bit kind of standardized to some degree.
I think you're right. I think you're right. And that might be even as big of an imprint as the maybe even bigger than the mark that they've made on American healthcare is the their imprimatur um, on on American politics. And then, of course, as goes America, so goes so many other places to treat it like you're trying to push a product, like you're trying to sell a product. Um, so tap into the fears, whatever is the most salient fear. Socialism generally works on this side of the pond. Um, but the other always works too, generally. And then give them a private option.
Hmm.
Give
Yeah.
some of them a private option.
Well, because that is an interesting component of actually. Again, I don't necessarily interact with it, but when I was just doing research and bits and pieces for the episode, something that kept coming up is that frequently individuals that are paying for healthcare expenses, I guess it depends on what it is, but if they're paying and they don't have healthcare, their price seems to be lower from a lot of hospitals than the price when if they are going through like the health through their insurance system. I'm kind of curious as to how the influence of kind of the insurance schemes actually does what kind of influence these insurance firms do have on the actual healthcare industry itself in regards to maybe extra steps, things like pharmacy benefit managers being introduced, and it just affects on overall lot of costs. And I guess
Yes,
also just
yes.
to get to add on to that as well, is there an argument to be made if you had like a completely free healthcare system without an insurance based system? Is there a greater opportunity for, I don't know, free marketness to work in a system to have a little bit more competition?
There are many ways to achieve universal health care. And it's a fundamentally challenging problem. How much do you want to pay on healthcare? Because try and answer it for your own self. Like, what if someone you love was sick? What wouldn't you give to save them? Even, and of course, you don't know if you could 100% save them, but what are you going to give for a 50% chance, for a 20% chance, for a 2% chance? Now you try and aggregate that question up, it's incredibly difficult, at the societal level. Um, and I just want to point out that the US spends more on healthcare than any other country on a per capita basis. And as a percent of our GDP, we're spending about 17% of our GDP, 18% on GDP. We get excited when we don't grow as fast as we used to grow. I know medical expenses have been growing across the world, but ours have been growing fastest, and we're starting from a higher point. And we didn't used to be that different. It has gotten more expensive over the last 3 decades. We've diverged even more from the rest of the OECD. Um, Obviously, our life expectancy outcomes are not at the top. We're, I think, 3.5 years on average less than the OECD countries. Um, there's a lot that goes into life expectancy. Obviously, there's behaviors as well as health and care. But actually, we're a younger population. We skew younger because our birth rate is higher. We have historically had more immigration, and we have lower rates of alcohol and tobacco use. So it's not what we have more of is, of course, obesity. And you could think about the omitted variable of regulation that sits behind both of those things. Um, so, what do we get for paying that much more, and who's paying that much more? We pay as a percent of the overall GDP publicly, directly from the taxpayer, about the same as any other country. Okay. So we pay, like, let's say on average, we pay um, 18%, 17%, let's make it 18% of our GDP. 9% would be public financing. 9 to 10% would be public financing. So now you can see when you hear like Germany say it's 12%, Canada say it's 11%, the US is right there. just publicly. Okay. That's Medicare, that's Medicaid, and that is importantly now through Obamacare subsidies to private insurance companies. And then on top of that, we have all the premiums and that's actually what leads private that and 60% of Americans pay for insurance themselves. And we get a payroll tax for Medicare. So we're doing everything. We're doing all of it. And it's very complex. There's a lot of intermediation, and that's where we're seeing these prices so high.
Yeah, certainly. And I think, I don't know, again, maybe you can elaborate a lot on this for me, and because it does sound as though it's a very complicated system with kind of the mix of sort of public and private and different sort of components of it. But for example, for like the sort of public component, which as you point out, the American citizens are paying a lot of money towards in terms of their sort of economic output. I think I could be wrong on this, but I think it's something silly like Medicare and Medicaid actually can't properly negotiate prices on things like prescriptions, for example,
That's
because it was
right.
like because it was written into the part of the legislation. And when I
Yes,
think
that's
about
true.
like again, by the way, the UK healthcare system is far from perfect. And the Thomas Sowell quote, there are no solutions, only trade-offs, like comes to mind when I talk about like a lot of these things, right? But one of the benefits of having a fully public health care system, at least in terms of prescriptions, for example, is that you can basically bulk buy on an aggregate level for the population. And so, when I was younger, I had acne. I used to get acne medication from the NHS to kind of sort out that. And originally, I was on tetracycline. Halfway, 6 months into being on that prescription, they switched me over to limacycline. Why? It's because the government had basically chosen that as their drug of choice for to combating acne in a lot of regards. And because it was the same active ingredient, that's why they changed over. It was just a different provider. And because they had the power to negotiate and choose other providers, it means they can cut the costs down. So prescriptions are obviously much, much cheaper in jurisdiction. So it does surprise me if you were going to have a Medicare, Medicaid system that, to your point, does, Americans
Well,
are paying a lot of money into for public health
and
care,
and I think
but
I
you don't
think
have the benefits of that system necessarily.
that's that I so I would agree with you. And I also I'm so I think it's so thoughtful that you would say, like, why are we doing this as an insurance? Like, what does it mean to be insurance? The principle of insurance is your premium is equal to your expected cost,
Hmm.
right? I mean, that's
Yeah, yeah.
basically that's an actuarially fair premium. And so how does that lead you to have insurance? Well, it means that you're smoothing your marginal utility of consumption is the smooth across both states of the world, right? That's not exactly what we're talking about when we're talking about these systems. What what that's in distinction to the solidarity principle, which is like you pay according to need, you receive according to your benefit. And the sort of the way that um the whole idea of risk sharing is like you people that are healthy support the people that are sick, the people that are young support the people that are old. And you do that because you say to yourself, well, one day, God willing, I'm old. One day I might, get pregnant, or, one day I might have an accident at work, or one day my plant might shut down. I mean, that's the system of social insurance. We call it insurance, but it's not this actuarially fair concept that we use in all of our models. It's this more solidarity principle of you're all in this together and you kind of trade things off in that way. And, what are the benefits to the private system? Well, you know, there's a lot of benefits. There's huge benefits to markets, but markets are not the same thing as prices. I mean, markets are just places where things are traded, and they often are traded based on matching function. Is we have a whole literature on that, and they're traded according to rules. And we use prices as a way to allocate goods just as one particular allocative mechanism. Another would be, we're going to design a system whereby we decide who has the most medical need through a process, and that then we match people according to those needs. So, I mean, it's a little bit of a um, we have to do better as economists in describing what markets are and the role that prices can have. Prices are really good incentives, but they're a really blunt instrument when it comes to distribution. They're really good incentive for like innovation or effort, really blunt instrument when it comes from, you know, I think in my view, allocative when you're trying to distribute something like education or healthcare.
Mm. Yeah, certainly.
I do want to say one more thing about innovation. I'm not entirely sure that at least the insurance sector, prices, fine. You can say prices, the degree that, you know, prices, um, that, again, the US is a wealthy country. It could negotiate and still pay very high prices to pharmaceutical firms for innovation, but I'm not sure the intermediation, and the market power that drive up our prices in healthcare are what's driving our innovation. I think we get a lot of things patented here. A lot of scientists come here because we had to recently a very vibrant, education, graduate education and grant system through the NIH and NSF. And then, of course, if you patent, you get the returns to that. But we could have high returns, I would say, and an educational ecosystem probably the most important drivers of that.
No, certainly. Marcella, this has been fantastic. I really appreciate you taking the time